31,000 years ago, someone cut off a human leg with a stone tool, and the patient survived for years. No hospital, no antibiotics, no trained surgeon, no clean operation room. Just pain, blood, a sharp stone, and a group of people who somehow knew what to do. That should sound impossible. Even today, if someone says, "Don't worry, I'll remove your leg with this rock," you're not saying, "Okay, bro, I trust the process." You're leaving fast. But this person didn't just survive the operation, the bone healed. They lived for years after it. So here's the question. If there were no doctors, no pharmacies, and no modern painkillers, how were our ancestors doing things that looked like medicine, surgery, and pain control? And this was not the only strange case. Neanderthals may have drilled infected teeth, some people opened skulls, some treated wounds with honey, some carried fungus like medicine, and some ancient physicians treated headaches with electric fish. Yes, fish. Not eating fish, shock your head fish. So maybe early humans didn't survive pain because they were simply tougher. That's too easy. They survived because pain forced them to experiment, remember, and trust each other. And some of their solutions were smart, some were terrifying, and some were so weird that if your doctor suggested them today, you'd ask for a second doctor. Imagine you wake up thousands of years ago with a tooth infection. Bad morning. Your face is swollen, you can't chew properly, you can't sleep, you can't hunt well, and there's no dentist saying open wide. There's only one person nearby holding a sharp stone and looking way too confident. But here's what makes this weird. Neanderthals may have actually done dental work. A Neanderthal molar from Siberia, around 59,000 years old, showed signs of deliberate drilling. Tiny spiral marks and scratches suggest someone used a stone tool to work inside a deep cavity. Not as decoration, not because cave life was boring, probably to relieve pressure, infection, or pain, and the tooth continued to wear afterward. That means the person survived. So the first answer is simple. They were not just suffering quietly, they were trying to fix the problem. But that creates a worse question. If they drilled teeth with stone tools, how did they deal with the pain? Because even modern dental treatment scares people. Now remove the chair, remove the gloves, remove the numbing injection, remove the friendly receptionist. You're left with Stone Age dentistry. And your dentist is probably a cousin holding a sharp rock. So they turned to the first pharmacy on Earth, nature. But nature was not a safe pharmacy. Some plants helped, some plants did nothing, some plants could kill you, and some plants probably made you see things you did not ask to see. So the trick was not just eat plants, the trick was knowing which plant, how much, and when. Neanderthal dental plaque has shown traces of bitter plants like yarrow and chamomile. These were not tasty snacks. Nobody chews bitter plants because dinner is going great. Both plants have anti-inflammatory and pain-relieving properties, so they may have been used because they helped. Then there's poplar bark. One Neanderthal with a dental abscess appears to have consumed poplar bark. Poplar contains compounds related to salicylic acid, connected to the pain relief family of aspirin. So before aspirin tablets, someone with a terrible tooth problem may have been chewing tree bark. Imagine being in so much pain that the tree becomes your medicine cabinet. And honestly, if it worked even a little, that tree was now family. There's also evidence of penicillium mold in Neanderthal dental material. Now that doesn't mean they invented modern antibiotics. They were not in a cave saying, "Bring me the microscope." But it does show something important. They were living around substances that could have medicinal effects. And maybe over time, groups noticed results. This bark helped, that plant made swelling lower, that other plant made uncle disappear into the forest for 3 hours, so maybe less of that one. That's how early medicine begins. Observation, memory, and a lot of painful trial and error. But plants were not enough, because what happens when the body's too damaged? A broken foot, a lost arm, a head injury, a wound that won't close. But here's what makes this weird. If pain relief was not enough, what kept badly injured people alive? The answer was not always medicine. Sometimes the medicine was the group. One of the strongest examples is Shanidar 1, a Neanderthal from Iraq. His skeleton shows serious injuries, a major head injury, possible blindness, a withered arm, a healed foot fracture, joint disease. This was not someone who just needed a nap. This was a man who probably could not survive alone. He may not have moved easily. He may not have hunted like others. He may have needed help for years. And yet, he lived. That means someone fed him, someone protected him, someone kept him close. This matters because it changes the whole picture. The real medicine was not only a plant, it was other humans. Pain did not just create treatment. Pain created care. And care is not a small thing in a world where one mistake can get you eaten, frozen, infected, or left behind. So when we imagine early people as brutal survival machines, the bones say something else. They did not always throw weakness away. Sometimes they carried it, sometimes they protected it, Sometimes they made space for someone who could no longer fight like before. And then care became something bigger, surgery. Now we return to that 31,000-year-old case from Borneo. A skeleton was found with the lower part of the left leg removed. The cut was clean, the bone showed healing. The person survived for years after the amputation. This is not just someone got injured, this looks like a deliberate operation. An amputation is not only cutting. You have to control bleeding, you have to avoid killing a patient immediately. You have to protect the wound afterward, you have to feed and care for the person while they recover. So the group must have had practical knowledge. Not textbook medicine, but enough to understand the body in a real, useful way. Where to cut, how to manage blood, how to keep the wound from becoming a death sentence, and this happened long before cities, written medical books, or hospital beds. So the idea that complex surgery only began after farming, this discovery makes that idea look very uncomfortable. But then humans did something even more terrifying. They stopped treating pain only from the outside and started cutting into the skull. This is trepanation. Trepanation means making a hole in the skull. And yes, that sounds like a plan that should be rejected immediately. His head hurts? Okay, what if we open the skull? No, everyone go home. But ancient people actually did it. Across different regions, skulls have been found with holes made by scraping or drilling. And many skulls show healed edges. That means patients survived. Some lived for years afterward. In the Andes, trepanation became shockingly advanced. Studies of hundreds of Peruvian skulls show survival rates improving over time. Early results were much lower, but during the Inca period, survival estimates reached around 75 to 83%. That's not random luck. That's skill improving across generations. They learned where not to cut. They avoided major blood vessels. They tried not to damage deeper protective layers. Basically, every operation taught the next healer something, which is impressive, and also a horrible way to become educated. Then there was early ear surgery. A 5,300-year-old skull from northern Spain shows evidence of surgery behind both ears, probably to treat a serious ear infection. The patient was likely an elderly woman. The holes were made with an abrasive drilling technique, probably using a flint tool. The tool may have been heated again and again, possibly for cauterization. Researchers described the pain as unbearable. That's a very polite academic way of saying this was nightmare-level pain. And yet, she survived at least for some time. So now we have a bigger problem. If people were drilling teeth, cutting limbs, opening skulls, and operating near ears, did they have stronger painkillers? Yes. But once humans learned plants could dull pain, they found a more dangerous problem. Some medicines were only one bite away from becoming poison. Take coca. In the Andes, people chewed coca leaves for thousands of years. Coca helped reduce fatigue and pain, especially in harsh mountain environments. If you're cold, hungry, sore, climbing, carrying, and working at high altitude, something that makes the body feel less exhausted is not luxury. It's survival support. Then there's opium. Opium poppy was cultivated very early in parts of Neolithic Europe and the Mediterranean. Its latex contains powerful pain-relieving compounds like morphine and codeine. Early people did not know those chemical names. They probably just knew this plant makes pain quiet. That's enough to make a plant important. Cannabis also appears in ancient medicinal and ritual contexts at the Yanghai tombs in China. Archaeologists found a large amount of cannabis in a shaman's tomb around 2,700 years old. Chemical evidence suggested it had psychoactive strength. So this was not random dry plant trash. It was valued. And then there were dangerous plants like henbane and nightshade. These could reduce pain or cause hallucinations. They could also poison you. So ancient medicine was not a clean shelf. It was a gamble. A little might help. Too much and now the healer has created a new problem. But the weirdest pain treatment was not a plant. Not bark, not honey, not opium. A fish. Ancient physicians used electric fish for pain. Egyptian, Greek, and Roman traditions mention electric catfish or torpedo rays being used for headaches and body pain. A Roman physician described placing a live torpedo fish on the head until numbness happened. Imagine going to the doctor with a headache, and he says, "Good news, we have fish. Not soup, not medicine, fish. And not a common fish, a fish that attacks your nervous system." But here's the strange part. They were not completely wrong. Electric shocks can cause numbness, and numbness can reduce pain. So thousands of years before modern electrotherapy, people noticed that electricity could change how pain felt. Was it crude? Yes. Was it weird? Extremely. Would I choose it over skull drilling? Honestly, yes. Give me the fish. But pain was not only about stopping the feeling. You also had to survive the wound after, because in the ancient world, the cut was only part one. Part two was infection. A bite could rot, a burn could swell, a surgery wound could turn deadly. So they needed dressings. And one of the best ancient wound materials was honey. Egyptians used dressings made with honey, grease, and lint. Honey helped fight bacteria and kept bandages from sticking badly to wounds. Grease created a barrier, lint covered the injury. Simple, practical, useful. They didn't need microscopes to notice the difference. This wound healed better, that one smelled worse. This dressing came off clean, that one made the patient scream like a goat. Observation became medicine. Other natural materials may have helped too. Neanderthals made birch tar, usually known as glue for tools, but modern experiments suggest birch tar can have antibacterial activity. So one material could help half the spear and maybe help protect a wound. Very efficient, terrifying lifestyle. Good engineering. Then there's Otzi, the 5,300-year-old mummy from the Alps. He carried birch polypore fungus. This fungus has antibacterial, antiparasitic, and anti-inflammatory properties. Some researchers think he carried it for parasites or minor injuries. So Otzi was walking through the mountains with tools, clothing, weapons, and fungus medicine. That's not primitive. That's a survival kit. Now the whole picture becomes clear. Pain survival had layers. First, simple relief. Bark, yarrow, chamomile. Then stronger substances, coca, opium, cannabis, dangerous plants. Then wound care, honey, grease, lint, tar, fungus. Then surgery, teeth, limbs, skulls, ears. And under all of it was the glue. Because none of this works if the patient is alone. A person recovering from amputation needs food. A person with a skull wound needs protection. A person with a broken foot needs patience. A half-blind injured elder needs the group to not walk away. So the biggest painkiller was not a plan, it was trust. Pain did not just create medicine, pain created trust. Because the first patient had to believe that someone holding a sharp stone was trying to save them, not finish the job. That's a huge human moment. Someone had to say, I'm hurt, and someone else had to say, I will help, even if the help looked absolutely terrifying. And that may be one reason humans became so powerful. We didn't survive only because of strong bodies. We survived because injured people were sometimes carried, fed, treated, and remembered. And when they survived, knowledge survived with them. Which plant helped, which wound dressing worked, which cut was too dangerous, which fish numbed pain, and which fish was just personally attacking you. So no, our ancestors did not survive pain because they were magically tougher. They survived because they became experimenters, healers, patients, and caregivers. Not perfect ones, not always safe ones. Definitely not the kind you want doing dental work today. But they were learning. A toothache led to drilling, a wound led to honey dressing, a broken body led to care. A headache led to electric fish, because humans will try anything once. And a missing leg became one of the oldest signs of serious surgery ever found. So next time you get a toothache and complain about booking a dentist appointment, remember this. Someone thousands of years ago had the same problem, and their dentist was probably a cousin holding a sharp rock. So here's the question. If you had to survive one ancient treatment, which would you choose? Stone tool tooth drilling, electric fish for a headache, honey dressing on a wound, or chewing bitter bark for pain? Choose carefully, because in the ancient world, the wrong treatment didn't just fail, it became archaeology.